Good morning, good afternoon, good evening. My name is June Musau, Country Engagement and Support Coordinator at the Financing Alliance for Health, and a proud member of the 2022 East Africa Leadership Journey Cohort. I'm excited to present to you my project, which seeks to craft a medical students program towards resilience and well-being. How often do you find yourself in such a situation? To kick off my presentation, I'm going to give two definitions of what wellness is according to the Global Wellness Institute and the WHO. The WHO defines wellness as the optimal state of health of individuals and groups, and wellness is expressed as a positive approach to living. The primary difference between health and wellness is that health is the goal and wellness is the active process of achieving it. Whereas the Global Wellness Institute defines wellness as the active pursuit of activities, choices, and lifestyles that lead to a state of holistic health. Coming to the Kenyan context and looking at the mental health of a Kenyan medical student. Globally, current trends indicate that medical illness, substance use, and burnout are more prevalent in medical students compared to the general population, and this is due to excessive academic, personal, and societal stressors. In Kenya, it is reported that 98% of burnout among health professionals and medical students is because of unfavorable work conditions and environments and a very weak health system. Further, young medical students are at a higher risk of suffering from burnout in comparison with peers in non-related health causes. These students are likely to suffer stress in their fourth, fifth, and sixth year of clinical study. What does this lead to? Poor mental and societal health due to burnout. The theory of change in this project is centered around 6 bubbles. The first being the need to involve a wide stakeholder forum. I will get in touch, or I'm already working with stakeholders who work with the students in and out of the school environment. These stakeholders will be critical in helping me identify the actual problems and also designing the program. Number 2, 2 critical interventions will be employed here. 1, an online student wellness survey. 2, designing of wellness interventions that are personalized. What are the mechanisms of change? 3 critical mechanisms of change is what I see in this project. 1, students will be actively engaged in the program. 2, there will be improved social connection in and out of school for students. And 3rd, students will understand the need for self-care. Number 4, the intermediate and long-term outcomes of my project are 2, I will employ different tools of measuring success. 1, I will seek to understand well-being and its importance. Number 2, students' well-being. Number 5, resilience and well-being is a value for this project. The value proposition for this program is resilience and well-being for students. Where am I right now? For me to be able to report success in this project, I will need to co-create and create strategic partnerships. I will need to have a robust marketing and communication strategy. I will need to embrace IT to amplify and impact. And lastly, have personalized interventions. So where am I right now with the program, the project? Consultative meetings with key stakeholders have kicked off. Number 2, the students' wellness online survey tool is ready. And so the next steps will be administering this tool, analyzing the data, which is going to inform me in the designing of the program, launching and rolling out of the wellness program, and lastly, enrolling students into the program. What is my call to action? I call upon all ecosystem partners to come join me in designing this dream project, which I believe will produce a medical student whose optimal state of well-being is a positive outlook to live in. Thank you for your time.